Hi, I'm Dr. Zahra Stardust. I am the co-chair of the Sexual Rights Committee at the World Association for Sexual Health. We are here in the beautiful Meanjin, place of the blue water lilies, on the land of the sovereign Turrbal and Yugara peoples. We began the conference with a gorgeous smoking ceremony by Auntie Kathy. We heard from Professor James Ward speaking about how sexual and reproductive health has always been a part of Aboriginal and Torres Strait Islander people's survival over the last 65,000 years on this continent. We heard from Lauren French speaking about how sexual and reproductive health and care has always been part of First Nations people's practices of intimacy and kinship and relationality. So it's been a really exciting conference. One of my personal highlights was a panel that we had to celebrate the success of the campaign to decriminalise sex work in Queensland, which has been a long-standing campaign. We now have 4 jurisdictions in Australia that have passed decriminalisation bills. We are leading the way here, and there is a global movement that is accelerating for the decriminalisation of sex work worldwide. We have also coming up today a panel I'm really excited about, all about intersex human rights, which is all about depathologization and law reform to stop the non-consensual medical and other interventions on intersex young people and babies. So that's something I'm really looking forward to. We had a fantastic session yesterday that was all about sexual and reproductive health for people who are migrants, refugees, people who are displaced, thinking about people's needs in conflict zones, in humanitarian crises. And of course, this is a really important area for WAS coming up in the next few years, given what's happening around the world, the ethnic cleansing and the genocide in Palestine, the use of sexual violence as a weapon of war in Darfur, the mass displacement of women and girls and families across Latin America, particularly Central and South America. So yeah, we've been having some really fantastic conversations too, all about comprehensive sexuality education and what that means and how we do it at a time when sexual and reproductive health, rights and justice are under threat politically around the world. And we are seeing criminalization of trans people's rights to gender-affirming care, to abortion and abortion care, to comprehensive sex education, to sex work. And many countries around the world are failing to fulfill their obligations, their legal and human rights obligations in relation to sexual rights. And I think most importantly, we are hearing from marginalized communities the importance of putting marginalized communities first as leaders in our movements to make sure their responses are locally grounded and culturally relevant, and to make sure that our movement is a movement for sexual and reproductive health, rights and justice for everybody.